Faith and Fitness is a health education program designed for African American women. Health disparities among African American women are some of the largest disparities in the U.S. and even in the world. And so we wanted to do a twofold program where, first of all, we raised the awareness of what the health disparities were, whether it was like heart disease, cancer, diabetes, chronic disease, to then take it to the next level to provide the education on how to do preventable things that would help divert some of those diseases.
I had just had my 65th birthday and I had an episode with my heart for a couple of days. But the good news is I had been participating in Faith and Fitness and getting myself in shape. It wasn't a full-blown heart attack.
When an individual feels that empowerment to change their health outcomes, they eat healthier, exercise appropriately, and keep scheduled medical appointments, resulting in less crisis management of their health. The community health worker programs can reduce or possibly end health disparities by assisting individuals to identify barriers and then developing a self-management plan to overcome those barriers.
Other programs, you have to pay to get into them, and it wasn't affordable, first of all. And basically, it was something that's going to help my life, help me to save my life. We can live, and we have a better excuse to live because we can better our lives through faith and fitness.
Everybody has to stay healthy. If you prevent it early, later on you're not going to have that many health problems, high blood pressure, whatever. You can eliminate that if you get out there and do things. And that's the number one thing, just get out there, exercise.
It's important to have a community focus as we develop community health worker standards for the state, because without that community input, you're going to miss out on the different cultures. Missouri is a very diverse state. It's becoming more diverse every year. And without their input, you're going to develop a curriculum that just are a standard that just may not fit with a different culture.
Since we've started the Faith and Fitness, our attendance not only in the Faith and Fitness classes, but also in church has improved. The attitudes of the people are so much better now within the congregation. And I think that it's important in our community, especially in the Black community, because we tend to want to always give others advice and we tend to forget about ourselves sometimes. And so having someone to kind of push them along the way to say, okay, if you're not taking good care of yourself, then how can you help somebody else?